This report discusses the error distribution law based on the analysis of a 10-factor regression model for predicting asthma severity in children. Bronchial asthma holds a specific place among allergic diseases. Currently, due to the rapid increase of asthma incidence, this pathology can be considered as a global medical problem. Development of approaches in the disease treatment, as well as the new medications creation, did not allow consolidating control over bronchial asthma. For this reason, the search of inflammation biomarkers is the most pressing challenge. When studying the role of thymic stromal lymphopoietin, its direct involvement in initiation and support of allergic inflammation in bronchial asthma is confirmed. Studying not only the factors, but also determining their relationship with each other is an important step in understanding the course of the disease in each individual case. Regression models are used for preliminary assessment of the severity of bronchial asthma. Despite similar symptoms of bronchial asthma among patients, the result of treatment and further prognosis of the disease is very different. Investigations have confirmed the presence of various phenotypes of the disease and influence of a huge number of factors on the occurrence of bronchial asthma and peculiarities of its course. In this regard, the issue of choosing factors to obtain satisfactory accuracy and what types of models should be used is relevant. The use of a limited number of studies in determination by the methodology and the standard set of reagents. To demonstrate the methodology for constructing approximate models regression, we will use the result of a clinical study of severity of bronchial asthma in children of the Kharkiv region in 2017. The asthma severity analysis group includes 90 children aged 6 to 18 years. The structure of the group was as follows. The main subgroup included 70 children with bronchial asthma, the control group 20 healthy children. Analyze the data of a survey of parents about the symptoms in patients, characteristic of bronchial asthma, as well as the history of the disease of the patient. The information served as the basis of the values of the qualitative factor used to build the regression model. The clinical features of the course of the disease has been studied. Based on the results of laboratory studies, the values of the quantitative factors of the model were formed. During the analysis, 142 factors were considered. The study purpose is research of the regression model features of thymic stromal lymphopoietin level in blood serum. In order to determine the significance of thymic stromal lymphopoietin in the pathogenesis of bronchial asthma in children, the level of thymic stromal lymphopoietin was studied depending on the clinical signs of a disease, numerical characteristics of which are presented in table. Schematic prediction of regression factor is one of the main criteria of model regression selection. This analysis will allow us to obtain diagnostic information about the predictor variable by determining outlier values of factors that have an effect on selecting of regression function factors. Diagnostic information about the range and concentration of X levels in the study helps to adjust the range of regression analysis certainty. For schematic prediction, when choosing model parameters, we use a distribution histogram of model regression qualitative values. Distribution histograms of model regressor qualitative values are given in figure. The result of a histograms analysis were used to correct initial values of raw experimental data. During the analysis, the data containing measurement error were excluded. As a result of selection from a variety of models with the number of regressors equal to 10, 7, 5, 3, 2, and 1, the model with the highest and lowest MSE values was selected. The results of the choice of models are presented in the table. When building linear regression models, outliers were removed from the original dataset. The figure shows the environment of two outliers in experimental data. Application for predicting TLSP in linear models number 101 with the regressors. After the outliers removal, the MSE value decreased by 30%, from MSE equal to 22.97 to MSE equal to 15.89 under 11 restrictions applied by linear regression model coefficients. The model of linear A regression with 10 regressors was studied in detail. More than 100 factors affecting the bronchial asthma severity in children were analyzed to form a set of models regressors. The criteria which allow forming an optimal set of models regressors were developed. As a result of statistical analysis, it was revealed that the confidence interval for coefficients of linear regression model is limited rather widely. It proves the necessity of model further improvement. Further research perspectives involve model construction techniques based on nonlinear regression equivalents of neural network application. Thank you for your attention.